All right.
And thank you, Laura. This is Laura Carpenter. She is a therapist in our Indiana practice primarily. And so thank you, Laura, for taking the time to share this with us today.
All right. Thank you. Hi. Thanks for joining us today. We're going to discuss supporting the caregiver. As Ann said, I'm Laura Carpenter. I'm a licensed clinical social worker and an oncology certified social worker on the behavioral health team here at American Oncology Network. So let's talk about who is a caregiver. Anyone who is helping another person through their cancer treatment. Caregivers can be family members, friends, and even professionals such as nurses, social workers, dietitians, any of us that are working with patients going through cancer care. Let's talk about today about what does giving care mean? Giving care means helping with daily tasks or needs, going to the doctor's visits, making meals, picking up medicines. It also includes helping your loved one with their feelings and their emotions. So being a caregiver might be a new role for you, and you might have been having, or you might be having various emotions and feelings. You may be feeling stressed and overwhelmed. You may not be sure as to what you're truly feeling, and you might not really understand your feelings. So there's no right way to feel. Each person's very different. So it's important to understand that what you're feeling is very normal. It's also important for you to share your feelings and to talk with someone who can help you. You can always talk with a counselor or a social worker. So these are some common feelings that caregivers experience. Sadness. It's okay to feel sad. But if it keeps you from doing what you need to, then I encourage you to talk to your doctor. Anger. You may be angry at yourself or family members. Maybe family members aren't helping like you think they should be, or you may feel anger at the person you're caring for. Anger comes from fear, panic, and stress. So I encourage you to look at what's beneath the anger, what's really truly causing the anger. You may be feeling grief. You may feel a loss of what you value most. You could be grieving your loved one's health or the loss of the day-to-day life that you had before cancer. Allow yourself the time and to grieve the losses. Guilt. Feeling guilty is very normal. You may feel you aren't doing enough for your loved one. You may also feel guilty that you're healthy and you're not the one with cancer. You may be feeling loneliness. You may feel lonely even if there are lots of people around you, and you may feel that no one understands what you're going through. You may start to self-isolate and not want to be around others. Understand that there's really no wrong or right way to feel, and that some of these feelings may come and go. Ask for help. Help is very important and crucial at this time. It can often be difficult for people, caregivers, to ask for help, but there are some benefits of doing so. Remember that when you ask for help, this also helps your loved one too. It helps you stay healthier and to have more energy so that you can care for them. Asking for help helps your loved one feel less guilty about you helping them. And others may be able to offer time and skills that you don't have. Many people may want to help, but they don't always know what you need, or they may not feel comfortable in asking you. So it's really important that you're honest and you ask for what you need. Here's some ways others can help you. Sometimes, we don't always think about ways that others can help us. So others can help with household duties like cooking, cleaning, or the laundry, going shopping for you, doing yard work, providing child care or even elder care if you're a caregiver of your parents. Often caregivers just need someone to listen to them, someone to talk with and to spend time with. You can get help with running errands. Maybe you need someone to help drive your loved one to their doctor's visits or to help pick up your children from school. Maybe it would be helpful if someone came to sit with your loved one while you run errands, or they can help you pick up your groceries or medications at the pharmacy. They're always often able to help with obtaining information that you might need or making phone calls to get resources for you. This is a time often where caregivers think their needs aren't important or they don't have time to take care of themselves. But taking time for yourself makes you a better caregiver and gives you the strength to keep going, especially if you have your own health concerns. So it's important to make time for yourself. And here are some ways to do that. Find things you enjoy. Try a new hobby or one that you haven't been able to do in a while. Watch a television show that you like or read a good book. We encourage you to be active, exercise or go for a walk, do morning stretching, gardening, or take your pets out for a walk. Oftentimes people feel that meditation and massage therapy often help. Listen to an uplifting podcast or attend a yoga class. Or if you can't go somewhere to attend it, then do an online yoga class. Another helpful thing is to connect with others, like joining a support group. Give yourself time to rest and to accept help when it's offered. It's important to do something for yourself each and every day. You shouldn't neglect your needs and self-care. Remember that you cannot pour from an empty cup. Alice is an experienced caregiver who has shared some words of wisdom. Alice says you need to learn ways to take care of yourself, because if you're not taking care of yourself, you can't take care of anyone else. So don't be afraid to ask questions. Don't be afraid to ask for help. As I mentioned earlier, many find that often it's helpful to be with others who are experiencing the similar situations and feelings as you. Sometimes you just need someone to listen and trade advice. It helps out a lot. So there are caregiver support groups that are held in various ways. Some are in person, some online, some held at local churches or at community centers. If you need help in finding a source of support, then ask your healthcare team. You can always ask a nurse or a social worker or someone who works in the clinic to help you find a support group. It is very common for caregivers to ignore their own healthcare needs. Caregivers have reported problems with sleep, headaches, anxiety, weight loss or gain, and other changes. So it's important for you to keep up with these needs. We recommend that you go to all of your checkups, take your medications as prescribed, try to eat healthy meals, rest as much as you can, exercise on a daily basis, and take time to relax. If you have health problems, it is very important that you follow your own treatment regimen. Adding extra stressors can cause more health concerns. But most importantly, you should listen to your mind and your body. I know these sound easy, but this is often very hard for caregivers to do. Cancer causes many caregivers to look at life in new ways. Often they question the purpose of their life and the focus on what they value most. Many will question why cancer has come into their lives. You might be grieving what life was like before the cancer, but you may also see some good things come out of it, such as bringing you closer to your loved one It's normal to see illness in both good and bad ways. So looking for meaning is a way to cope. So these are some ways that people find meaning. Read or listen to some uplifting materials. Pray or meditate. It might be helpful to talk with a priest, pastor, or a spiritual leader. Attend religious or spiritual services. Talk to other caregivers. Talk with a behavioral health therapist. And review websites, books, or brochures for people dealing with cancer. Communication during this time is key. Nearly all caregivers and their partners will experience more stress than usual in their relationship while they're going through this cancer journey. Some believe that their bonds get stronger, and others believe that they become weaker. So there's some common issues that couples feel stress about. How to support each other. The changing roles in their relationships and the changing routines. Your husband might be the one who always paid the bills, so now you have to take on that role. Making important decisions and important, effective decisions. How to manage daily life, work, the chores around the house, and caring for children. Remember, everyone deals with stress in different ways, so it's important that you be open and have open communication about it. Here are some ways we recommend to reduce the stress. Talk about how each of you feel. Share how you're coping. Talk about choices you can make together. And find ways to show appreciation for each other. And be available to focus on other things besides cancer. In my years of working with cancer patients and their caregivers while going through this journey, I've had caregivers say to me, I have all of these feelings and emotions, and I cry often, but I don't want my loved one to see me doing that. Then on the flip side, I've had the cancer patient say to me, I hear my wife crying at night, but she won't talk to me about it. But I really, really want to talk and help her cope with this. It's very important that you communicate with each other and express your feelings. This is often a time when communication becomes more difficult, but it's even more important to communicate with your close friends and family. Here are some helpful considerations when talking with others. Only talk to those who are close to you, and try to be open and caring. If you're having difficulty with the communication or understanding things, then ask for a family meeting with your healthcare provider or therapist. And if you are not able to share information with others, then ask someone else to update other family members when things are too stressful. One of the most difficult parts of the caregiver and patient's cancer journey is to talk about cancer with their children, especially younger children. But it's important to have open and honest conversations with them during this time. Here are some recommended tips on how to talk with children about cancer. Talk about the cancer diagnosis and answer their questions in an age-appropriate way. Let them know that their feelings are okay and valid. It's okay to be scared. Tell them the truth with love and hope. And really listen to them and their concerns. Find time to spend with them involved in normal activities. And seek help from a counselor or a social worker. But most importantly is don't try to keep cancer a secret. Children are intuitive. They see things and they hear things, so it's important to be honest. So as I close today, I would like for you to remember some key important points. it's important as a caregiver to embrace each day with open mind and heart. Strike a balance each day. Focus on your needs too. And care for yourself while caring for your loved one. It's okay to take time for rest and relaxation. So Emily, who was a caregiver, she also has provided some valuable insight. If there's one thing that comes out of taking care of someone, it's that I've learned what's important really fast. And that's a lesson that I'll carry with me forever. I have provided some national resources here for caregivers, as well as for cancer patients. And then I would just like to take a quick moment to introduce you to our behavioral health team here at American Oncology Network. As all of you met Ann Leach earlier, she is our behavioral health supervisor, and she is also one of our therapists in several of our clinics. You've met me, and then Kristen King, she is one of our other therapists, and then Nicole Kelly Gordon. Now, Ann, I'd like to open it up for any questions that anyone might have.
Okay, we do have a couple of questions, Laura. The first one is about dealing with guilt, and that how do I stop feeling guilty for asking for help?
Okay, well, I don't believe that there is a way to stop feeling guilty. It's very important that we're always going to feel guilt about something, but it's important to find strategies to move through that guilt, and so that you can ask for help and you can be able to better take care of your loved one and to provide for their needs. And if that includes that you need to talk with like a behavioral health therapist, then that's what I would recommend.
Okay, that's great. Another question okay, you said that it's important that we don't be afraid of talking to the patient about our feelings, but when I try to talk to my mom about her cancer diagnosis, I just can't stop crying and being emotional, and I don't want to upset her any more than she already is.
I understand that. None of us want to upset someone more. However, in my experience in working with cancer patients and caregivers, that they become more upset if you don't express those feelings and talk about how you're coping and talk about how you feel, because it's a journey together. And so even if you're not able to, do that without having those emotions, I think it's still important that you talk and you communicate and, you cry together, because that's helping them through their journey as well. Now, if you continue to have those emotions, then I would encourage you to seek, some counseling services from a behavioral health therapist to help you find strategies in dealing with those emotions.
We have one more question, Laura.
Okay.
This one, he is his brother's caregiver, and his brother has the same diagnosis that they saw their father pass away from. And my brother is very resistant to talking about his diagnosis. I feel like I need to talk about it to prepare him for the future. How do I handle that?
Well, I would recommend that you start off talking with your brother about how he's feeling and about what he's experiencing, and then kind of over time, give him time, but then over time to move that conversation into what, about the future and why it's important that you help him with that, and that it's important for you to be able to also prepare. And then if he continues to be extremely resistant, then you might want to recommend that you guys meet with a behavioral health therapist together and to help work through it.
Okay, I think we have time for one more question. This one, it says that they recently moved to a new area and the rest of their family are very far away, 5 states away, and don't have very much support. What's the best way to get help in our home and to help me when the time comes that my husband requires more care?
That's a great question. There are community providers that you can seek assistance from. So, I mean, depending on where you're at, depending on your type of insurance, different kinds of things depends on payment sources. So I would encourage you to ask your healthcare team if they have any referral resources that they can refer you to get that assistance.
I think that's all the questions that we have. So I think we'll be closing this. Now we certainly want to reiterate that we really appreciate everyone joining us today. And should you have any questions whatsoever, you can contact us. Laura has put her email address on the board, on the screen. And also you can contact any of the rest of us too. All of our email addresses are our first name and last name with a dot in between at aoncology.com. And thank you so much for joining us today. And have a great day, everybody.